This trial was to evaluate the interest of using circulating tumor cell detection and level of this circulating tumor cell in first-line metastatic hormonal receptor-positive, HER2 negative metastatic breast cancer patient. And the idea that it has been clearly demonstrated, and the level of evidence is really high, that the level and the detection of CTC is clearly related to the prognostic of this patient. So the idea was to use this information to help the decision between starting the treatment with hormonal treatment in first line or chemotherapy in first line for this patient. It was a randomized trial on nearly 800 patients. And this trial has shown that basing the decision or just the clinical feeling and the experience of the physician taking care of the patient, or just based on the level of CTC, gave the same result in terms of overall survival and progression-free survival for the patient. So that was one interest of this clinical trial. But also we have shown that for patients who had a high level of CTCs, starting with chemotherapy rather than hormonal treatment could give an advantage in terms of progression-free survival, and there was a good trend also for overall survival for this patient. However, these results were interesting in general, but now the strategy for this patient has changed, and the hormonal treatment is not given alone, and the standard of treatment integrate clearly now the use of CDK inhibitor. So would have been the result the same now integrating the CDK inhibitor? That was the main question. And so there is currently a clinical trial in France integrating also the CTC level in a clinical trial randomizing CDK inhibitor plus endocrine treatment versus chemotherapy in first line with patients with very with aggressive metastatic disease, HER2 negative and hormonal receptor positive metastatic breast cancer. So we'll see if this trial validate also the information given by CTCs.